Well, welcome to this second session of our NAMMA conference. I am so pleased to be joined by, again, three distinguished speakers. First is Captain Wayne Arguin, who is Director of Inspections and Compliance at Coast Guard Headquarters, the U.S. Coast Guard. Our second speaker, David Heindel, who is Secretary-Treasurer of the Seafarers International Union and Chairman of the International Transport Workers Federation Seafarers Section. He also serves with the ITF Seafarers Trust. And finally, Dr. Desai Shan, who is a professor at Memorial University in Newfoundland. I'd like to welcome the three as speakers. We'll go in that order, and we'll hear from all three, and then, like the last session, we'll open it again for questions. If you do have a question that you'd like to ask, what I suggest is you pop it in the chat box, and we can hold on to it until question period. Or when we get to question period, you can go in your Zoom bar, and under reactions, you can raise your hand, and we can see your hand, just like Kevin is doing right now. Thank you so much, Kevin, for showing how a hand can be raised. So first, I'd like to invite Captain Wayne Arguin, Director of Inspections and Compliance at the Coast Guard, to address us. Thank you, sir, for being with us today.
Well, thank you, Jason. Can you hear me all right?
Yes, sir.
All right, good deal. Well, good afternoon or good morning, depending on where you're at around the world. As Jason mentioned, my name's Wayne Arguin. I'm the Director of Inspections and Compliance here at Coast Guard Headquarters. And just wanted to touch base and sort of talk about sort of the Coast Guard's role in sort of cultivating partnerships, and specifically talk about how those partnerships have been vital as we've worked through the many challenges that this pandemic has posed toward us and will continue to pose as we sort of wrestle with the Delta variant. In my current role, I would say that, you know, as a career prevention officer, partnerships have been a foundation of what we do at the local port level throughout my career. In my time as the sector commander in New Orleans, I simply could not have done my job without the relationships that were built at the local level, and those same relationships at the regional and national level, and I would argue international level, are absolutely critical as we work through the very many challenges that face seafarers and just folks that work within the MTS. And one of the things that we ended up doing under Admiral Timmy's watch with the Committee for the Marine Transportation System, that's an interagency group as the pandemic sort of really started to build steam. We pulled together an interagency group, and I consider an interagency group both the internal side of, at least from the U.S. federal government perspective. I consider those partnerships as well. And so we pulled representatives from across the interagency to really take a look at any potential policies or issues that we needed to address to ease the burden, specifically within the marine transportation system, to support that hidden workforce that kept toilet paper on our shelves as best they could and kept the economy moving when everybody else was able to sit at home. And that work group, we established a COVID-19 work group and worked through a variety of different issues, both with respect to policy, but looking for best practices. This was really kind of a sort of a new, we've dealt with pandemic plans, but not on this scale. And so we were able to work through a variety of different policy adjustments, whether it was the Coast Guard dealing with licensing adjustments and being able to provide some relief for folks that needed to get their licenses renewed. But we look for those opportunities to ease that burden to the extent that we could within the scope of the law, but that we use that as a natural collection point for just issues. And they weren't issues specific to a particular agency, but we just kind of collected all the issues and said, all right, who has some sort of decision space here? And can we come up with a solution that we can implement quickly to provide that relief as fast as possible? And that partnership across the sort of the internal interagency really was effective. We met virtually, as many of you have done during this pandemic, which poses its own challenges using technology to try and get a group together and reach some consensus. But we figured out the technology much like everyone else, and we're able to work through a variety of different issues. And through that group, we were able to post best practices to really try and help grease the skids for folks that were thinking about issues across the entire spectrum of the MTS. And I will send you, Jason, I don't know if you've got the link to the CMTS Workgroup website. That's available for anyone that's interested in kind of seeing where we're at, and if there are additional policy issues that need to be addressed. That work group still is actively meeting. But that is just one example of how partnerships really helped us address some of these emerging issues. And I look at partnerships, really it's a collaboration. And it's a diversity of views, opinions, backgrounds. And so there, we don't get into this sort of stovepipe thinking. And we're able to look at really challenging, complex problem sets from a variety of different perspectives and really develop the best outcome. And that works not only in the pandemic, but it works in hurricane response. It works in, hey, we got a new sort of new stressor on the MTS. How do we address that in the most effective way? And bringing those teams together, working collaboratively and congenially, being able to openly talk about, here are my concerns, and let's figure out how best to address those, really does provide us with a lot of trade space to come up with the right solutions quickly. I would also say that, one of the more tangible examples of a partnership was really led by Jason. I had met Jason really for the first time when I was in New Orleans, and we were able to connect back up, trying to address the issue of providing vaccines for mariners. And the CMTS work group had been working really early on to try and elevate the status for U.S. mariners for vaccine priorities. Had just not been able to, things were moving so quickly, and there were so many complex sort of policies in place. The states were managing the stockpiles, who can get U.S. mariners into that profile that TSA, or not TSA, that CISA had identified as priority for vaccine distribution at the state level. We really were pushing in to make sure that people understood the significance of that workforce. That if the MTS takes a knee, that there are going to be significant impacts in being able to deliver those vital goods and services that kept the economy at least moving. And so worked through those issues, and we're able to sort of address that at least from a domestic perspective. But then the question of, what do we do about international seafarers? Those are the same folks, 90% of our trades coming on the water. How do we help protect those folks when we have arguably excess vaccine capacity here in the United States? We're sending vaccines over to countries, but we've got mariners right here today that are pulling into U.S. ports that we ought to be able to get a shot in, and we ought to be able to grease the skids to be able to make that an efficient, effective process throughout our ports. And so Jason called, and we worked with MARAD, and really it was a lot of you folks. And a lot of the folks within these different seafarers advocacy groups that were doing these grassroots sort of, I figured this problem set out in my backyard, and then provided the opportunity to share those best practices to other ports that were interested in doing something similar. And that, to me, that is the example for how partnerships can work. You distribute that workload across a variety of different folks. You work through some of those kinks, and you think creatively about how to get after those problem sets. And I think, I would argue, largely due to Jason's tenacious, motivated sort of efforts, brought the right folks in the room to be able to continue having those conversations. Is it a perfect solution? I would say no, but it is currently an effective solution. And Jason, what's the number so far for vaccinations in the U.S. for international seafarers? Last time I checked, it was a pretty decent number, but I'm sure it has gone up even more.
Somewhere just shy of 40,000, I think.
Yeah, so there are 40,000 mariners out there now that have been able to gain access, some easier than others, but we've identified, anytime we identify one of those kinks, in some instances, it's a local conversation. I engage with the local sector commanders to make sure that they are aware that that's a program that needs to be supported and fostered. And that only comes through a partnership. There's no, in my job description and the Coast Guard job description, there's no line item in there that says, figure out how to get vaccinations to mariners. It's the right thing to do. It's about mariner welfare. And so we were able to pull the right folks together that had those decisions at the local level and provide sort of the impetus for being able to arguably streamline some of those activities. In other places, it's been a little bit more challenging, but I think we've been able to show that it can be done and continue to work toward finding ways. I wish we could put together a national program that just says, here's the plan, here's how it's going to work. And we'll continue to work that. And we're going to fold that into lessons learned for the larger pandemic plan going forward, should this happen again. And so that really is, from my perspective, and I think if you look at talking with Admiral Mauger, partnerships are one of the legs of our prevention readiness initiative. We absolutely cannot do our job without that direct connection to our customers, to the folks that are influenced by the regulations that we put in place and the enforcement actions that we potentially take. We've got to have that input. And without that, I think we end up in a vacuum. And so we don't come up with the best solutions. And I would argue that we are not going to be able to move forward without continuing to expand those partnerships as MTS and as the world gets more and more complex, more and more technologically challenging. We've got to be able to bring the right folks in the room and have conversations so that we are addressing those issues quickly and most efficiently. So with that, I would just kind of leave, that's kind of from a Coast Guard perspective. Hopefully everybody takes away that we are very much interested in partnerships and absolutely will not be able to be as effective as a Coast Guard as we have been in the past without those continued relationships. And at the local level, each sector commander would argue the same case, that they are reliant on port partners and the folks at the deck plate level that are making those decisions to be able to effectively manage the port to keep commerce moving.
Captain Arguin, thank you very much for those comments. And if you could pass on to your colleagues at the port levels and the different sector levels, how important it is that to work with our local ministries in the various sectors and ports. It's really, really wonderful. Thank you very much. I have questions, but it's not yet question time. And I know others might have questions as well, but we'll have to keep those ready. If anyone does have a question, you can pop it in the chat box already. And we can get them ready, or you can, again, raise your hand when we come to question period. Our second speaker, Mr. David Heindel. Welcome, David, to this conversation. We'd love to hear from you.
Okay, thank you, Jason. I'd like to echo your thoughts also on thanking the sector commanders for their assistance through the course of our efforts to get seafarers vaccinated. I think it was a godsend to have this take place. So again, I would like to echo my thoughts on thanking the Coast Guard for their efforts in us achieving what we have managed to achieve over the last few short weeks. As far as the conference, I'd like to thank NAMMA and of course Jason for holding the conference and specifically having this panel. When I took a look at the title of Building Relationships Through the Pandemic, it's fitting, I think, that we have this conversation. And it's, in my mind, I think it's appropriate that we reflect and take note of what we have all experienced over the last year and a half, and also look at how we can take things to the next step or the next level. Of course, early on, none of us really knew exactly what was in store for the industry, the unions, all of the service providers, the welfare agencies, the seaman centers, and more importantly, what was to become known as the pandemic and how it impacted on seafarers. The first signs that our world was about to change and possibly change for forever was when government started shutting down borders. We quickly realized that this would immediately impact on crew changes, as well as the ability for seafarers to get ashore should they need medical attention. The ITF, along with the ship managers, immediately agreed to a 30-day delay in crew changes, and we subsequently agreed on another 30 days postponement for this. And based on our knowledge of what needs to happen on a monthly basis, approximately 100 to 125,000 seafarers need to make crew changes. And it doesn't take a rocket scientist to figure out if crew changes are not taking place each month, it doesn't take long to realize that you're going to have a 500,000 seafarers that are backed up, waiting to get off ships, which means another 500,000, 500,000 seafarers are home waiting to get back to provide for their families. And it's unfortunate what had happened, but as governments continued to close down the borders, it continued to make things worse on behalf of the people that I represent, and of course the ITF represents. We witnessed quite a terrible situation with regard to our seafarers over the course of the last year and a half. Fortunately for us, we are in an industry where a lot of the, whether it be ship managers or ship owners, they generally come from the sea. Most of them have worked at sea, and so they understand. It's not like they're blind to what seafarers go through on a day-to-day basis. So it was a perfect arrangement for all of us to actually look at what was happening, what we could anticipate going forward, and it allowed us the ability to get into a room like this, of course, a virtual room, and say, okay, this is what we have confronting us. How can we educate governments on actually on what they're actually doing to the seafarers and the supply chain that we all rely on? It wasn't hard for us to figure out that in order for us to be able to get a message out to the governments who are completely blind in what decisions they make or the impact that those decisions have on the supply chain and the people that work within it. In order for us to get our word out, we had to basically come together and put all of our whatever differences we have, and we all have our own ways of looking at how to provide for seafarers, ways in which that we can make things better. The ship owners have their interest, of course. The ITF and the unions have their interest, and welfare providers, of course, their job is basically to just provide a service. With regard to seafarers, the day-to-day work that the service providers, whether it's a welfare agency or a seaman center, fact is that the service that they provide is vital to the seafarers functioning, especially in these days, in times where a ship may come into port 6 hours, 12 hours. Lucky if you're allowed to stay in port 24 hours. So that service that the welfare agencies provide is amazing. Whether it's just running them up to the store or bringing material down to the ship, it's vital. And when the pandemic hit, basically it just completely shut everything down. And we thought in the ITF, we thought it was vitally important that we keep the seafarer centers open as best we could, or at least give them the ability, some sort of bridge between now and when the pandemic would end, assist them with some finances if that's what they needed. Same thing with some of the welfare agencies that would normally service the vessels. It was vitally important that the network that we had in place to assist seafarers continued. And as a result of that, the ITF Seafarers Trust, through all of our efforts on as far as the trustees go, we put $1 million on the table to assist in some of these centers as well as agencies to assist them in meeting their financial needs on a day-to-day basis. It wasn't going to put them in perfect financial position, but we thought it would be a bridge to help them sustain themselves through the course of the pandemic. However, we really didn't know how long the pandemic would last, and I guess we really still do not know. But we've done our bit as far as assisting the seafarer centers where we could, and where we felt that it was important that we keep them in an operational standard, if you would. But we know that it's not everything. And fortunately, a number of other welfare supporters, I should say, charities have stepped up and lent some assistance as well. But aside from the welfare agencies, as well as the seaman centers, we believe we gave somewhat of a lifeline through the course of the Seafarers Trust. And we hope that this pandemic will end soon so you can go back to your normal day-to-day operations. And of course, we all could go back to our normal day-to-day operations. However, through the course of the pandemic, with governments continuing to close their borders and basically having shore leave end for seafarers, seafarers weren't able to go down to the local store to pick up toothpaste, some shaving gear, whatever the basic necessities that we all take for granted today. They weren't able to get anything. And sometimes just a six-pack of Coke makes seafarers very happy, because it sort of breaks the monotony, if you will. And sometimes just going ashore, just walking around gives you the mental ability to continue on your trip, as far as being a seafarer, continuing to survive out there. Not being able to go ashore really hit the seafarers. And I know it just from the American seafarers who have been really stuck on ships. And there's no real reason for an American seafarer, and I'm sure the same thing could be said for the Canadian seafarers. They have a pretty good way of life. And if you take away the ability to go ashore, even in your own country, it makes it very difficult and has a psychological effect on seafarers. So I can only imagine seafarers coming from different parts of the world who are working 8, 9, 10 months a year, to be stuck on board the ship without having the ability to know when you're going to get home, or the ability to go ashore. The psychological effects that has on a seafarer is tremendous. But through the course of our working in partnerships with our partners at the International Bargaining Forum, or the IBF as we call it, and the Chamber of Shipping, we soon realized none of us could tackle this problem on our own. And we decided maybe we were forced to coordinate a response. We knew that we had to communicate with governments to educate them in what their decisions, what impact their decisions had. And in order for us to be able to do that, we had to work together. And I believe as Captain Arguin said, that people come from many different backgrounds and have many different ways of looking at solutions. But we managed between industry, the unions, and the unions to basically say, okay, this is something that we have to do. We've worked with the International Labor Organization to get our message out, worked with the IMO to get our message out, directly from with the UN, and a number of different groups that have come out in support of keeping the supply chain going. I believe it was covered this morning, some of it, but the bottom line is in order for us to be able to achieve what we needed to achieve, and that was educating governments and having a response to what governments were doing, we had to do it jointly. We found that it works best if we go in there hand in hand and have the same message, rather than giving two completely different messages to governments. We were better off going in there and having one succinct message to governments. And it has worked quite a bit. In my mind, I think it's worked to a great deal of success. We haven't achieved everything we wanted to achieve, but you know what? That's life. We just continue to push on, and hopefully at some point this pandemic ends, and we can go back to our corners and do what we normally do on a day-to-day basis. The social partners also agreed to continue to educate governments on what their decisions actually mean to the supply chain. Over the course of the last year and a half, as I said, we worked with the numerous UN agencies to try to support seafarers and what is happening. with regard to them being stuck on board ships for 15, 16, 17 months. Some have been on board through 2 holiday seasons already. And to witness that is unbelievable. Being a seafarer myself, when you know that you're due to get off September 1st or October 1st, and the ship changes, ship's orders are changed, well, you get very disappointed. And if that happens over and over again, it has a huge impact on the psychology of a seafarer's mind. They actually lose all hope. And at this point, there are many seafarers who have lost hope, I believe, at this point. And that's not good for us. It's not good for, when I say us, I'm talking about for the industry as a whole. Certainly, it doesn't help us in recruiting seafarers that are potentially could be coming down the road. There's a huge impact that places on the industry and the people that work in it. Through it all, though, we managed to get our message out and get much needed relief for seafarers in the industry. While it may not have solved the problems completely or entirely, I believe it is important that we continue to work together with one voice that can speak on behalf of everyone in the industry. While industry and labor works to resolve the problems that governments continue to labor for us, I would be remiss if I didn't mention that vaccines are key to protecting our seafarers and freeing up our ability to basically routine crew changes in the future. We believe that it's necessary that seafarers continue to have access to the vaccines. And I thank Jason for his efforts in keeping all of us informed on new places that are offering vaccines, as well as the countries that are actually stepping up and offering those vital vaccines to those seafarers that are visiting their ports. Because without the vaccines, this thing would just continue to spiral. And we believe that our freedom that we need to sustain this industry is through the vaccines. So if we can continue to support the seafarers as they come into ports and they can have the vaccines offered to them, I think that's the first step in us getting our freedoms back. And it's vitally important that we all play a role in making sure that seafarers can get the vaccines. If they decide not to get a vaccine, well, that's a different story. But I think the fact is that as long as we can offer them and they could actually have the vaccines, it's just a matter of time before this pandemic would be behind us. While there are politics that come into play with these vaccines, as we all know. Some people don't want to get a vaccine for various reasons, maybe health, maybe religion, or perhaps just because they feel that the vaccines are, they're not well known what's in the vaccines. Well, it's just a lack of education in my mind. And over the course of time, I think people are going to come to believe that that the vaccines are the best way to go in order to get this behind us. So, as far as us working together, there's no doubt in my mind or the minds of anyone in the ITF that we must continue to work together. If we don't, we're all going to be going in different ways. And I think that gives a bad message to the people we're trying to communicate with. And that's the governments who are really telling us what we can and can't do. So with that, I'll stop there. I could probably go on for a little longer, but I'll stop there and take any questions if anybody has any. Thank you, Jason. Thanks, everybody.
Thank you so much, David, for that presentation that dovetails with what Captain Arguin has said as well. As I said to Captain Arguin, so I say to you, thank you for all of your work for the benefit of seafarers' welfare organizations over the course of the pandemic. Thank you for their support of NAMMA via the ITF Seafarers Trust, but also I think people not all know it, but the monies that were made available via the ITF Inspectorate program were not from necessarily the ITF Seafarers Trust, but it was a special program. So thanks to Steve Trousdale I think the biggest thanks is just the on the ground work with ITF inspectors. That it's not so much just the money, but it's those personal connections of working together day to day. I've never had as sort of as NAMMA so much day to day connections with all of the ITF inspectors throughout North America as we have in the last 18 months and throughout this the vaccination program. So thank you, and let's keep on working together. We'll pass to our third speaker, and then we'll circle around for questions after our third speaker. So our third speaker is Dr. Desai Shan, who is a professor at Memorial University in Newfoundland. And I will share my screen again. I will share my screen, and Dr. Shan, are you there?
Yes, thanks, Jason. Hello, everyone. I'm Desai Shan, and I'm an assistant professor in occupational health and safety from Memorial University of Newfoundland. And thanks, Jason, for inviting me today. And also thanks for Wayne and David's excellent presentation. Thanks for all you have done for Seafarers during the COVID-19. So today, my presentation topic is basically on the very beautiful picture of NAMMA, I would say, on Jason's screen. So it's COVID-19's impact on seafarers. So Jason, could I have next slide, please? So COVID-19 has significantly changed the working environment of the shipping industry. So the impact is even more serious for seafarers and also fishing harvesters. So in this presentation today, so I will basically cover two aspects. So first, we will have an overview of seafarers' labor conditions. And secondly, I will share some of the preliminary research findings from our study. So what are the additional occupational health and safety challenges faced by seafarers during the COVID-19 pandemic? Next slide, please, Jason. Okay, so at the beginning of the pandemic in 2020, the first group people at sea attracted media attention with the seafarers working on cruise vessels, such as Diamond Princess, very famous case. So after the ship quarantine began, people realized that seafarers still need to continue to perform essential duties, such as delivering meals, changing lines, and distributing medicines. And later on, with the ban on the cruise vessel, then more and more reports have been pay attention to the merchant seafarers. So basically, merchant seafarers still need to working to ensure the sustainable operation of the global supply chain, as David just mentioned. So since March 2020, it was estimated that more than 400,000 merchant seafarers have been facing crew exchange crisis. So which means that they need to serve on board much longer than their normal service periods due to the travel restrictions in port states and their home states, sometimes even a worse situation. So in that case, that increasing flight expenses also disencourage ship owners to participate or to be a reliable partner to repatriate seafarers. So working more than 11 months and the maximum service period stipulated by Maritime Labor Convention, very common among seafarers. And for nowadays, probably for seafarers, it could work more than 2 years. So to address this crew exchange crisis, the UN General Assembly, also mentioned by David, that through the UN, through the IMO, through the IRO, that we need a one voice together for the industry. So the UN General Assembly also urged the member state to designate seafarers and other marine personnel as key workers through the resolution adopted on the December 1st, 2020. May I have next slide, please? So in this UN General Assembly resolution, it pointed out that the challenging labor conditions of seafarers and fishers have been further exacerbated by the impact of the COVID-19 pandemic and the related response measures, so including personal safety and health conditions and of work and the abilities of seafarers and fishers to join and leave ships, the inability of vessel operators and owners to change crews, in addition to other social and economic hardships arising from the COVID-19. So what are the challenging labor conditions at sea? So even before pandemic. So how the pandemic have exacerbated such challenging working conditions for seafarers. So Jason, may I have next slide, please? So let's first look at the challenging labor conditions at sea. So working at sea still encounter many different types of challenges, so including environmental hazards, weather challenges, work-related injuries, and infectious disease other than COVID-19. So firstly, as shown in previous study, the fatal accident rate among seafarers was 14.5 per 100,000 workers between 2003 and 2012. So what does this data mean? So it means that the fatality rate among seafarers was 21 times higher than that in the general labor force. And compared to the construction workers, which is also a high risky land-based industry, seafarers are 4.7 times more likely to face a fatal accident. So secondly, the shift works, I believe we probably all familiar with that. There are extremely long hours. Also, they increase the risk of fatigue of seafarers. So shipping is a 24/7 business, which requires basically seafarers either take 2 shifts of 6 hours in 24-hour period, or some basically people could take 4/8, so 4 hours on, 8 hours off, or 12 hours on, 12 hours off. So for international seafarers, 4/8 is more common, and 6/6 more common even they are in the port. So for the maximum service periods, Maritime Labor Convention basically said 11 months, and we can see that is no longer the case during the COVID-19, and the service could be extended longer and longer. Domestic Canadian seafarers normally would take 6 weeks on, 6 weeks off, or 3 months on, 3 months off. So as David mentioned, for domestic seafarers, we haven't heard about much difficulties aboard taking, let's say, signing off. For international seafarers, they are more likely to face the signing off difficulties due to the travel restriction in the port state, sometimes even worse in their home state. So for example, like in China, basically during 2020, China has taken the very stringent anti-COVID-19 policies. And for the Chinese citizens overseas could not be returned or repatriated to China due to some traveling restrictions. Also for the nutrition issues on board the vessel. So that existed for a long time. So the lack of fresh vegetable, that is caused by many reasons. So I recently read a seafarer's post online. So still for many years, their food budget per day is $6 per day. So that's very difficult for them to purchase any fresh vegetable or fruits, let's say in the United States or in Canada. And also another issue is that in some ports, the seafarers are basically afraid of interacting with the port personnel, and then they couldn't go ashore to purchase these fresh vegetables and fruits. So they sometimes, for example, like Chinese seafarers, they only do the purchase in China. And normally at the end of the voyage, they could only rely on potatoes and onions. So limited access to healthcare services, even before COVID-19, to access healthcare services for international seafarers may be difficult depending on the port state. And during the COVID-19 situation, become even more difficult. Exposure to noxious chemical products, including fuel, noise exposure, vibration, and infectious disease, those are being reported in previous studies. May I have next slide, please, Jason? Thank you. Mental health challenges. So we talked quite a lot about mental health challenges in recent years. It's because we found that the depression and anxiety are quite commonly mental health problems reported by seafarers. And according to a study conducted by Yale University, that there are high prevalence of anxiety and depression were found among seafarers. So, and the isolated and confined working environment and limited access to internet previously in particular. Maybe things change a little bit, improved during the COVID-19 pandemic, more and more companies being more generous to provide internet access for their seafarers. Also separation from families and friends also makes the situation even difficult for seafarers to address anxiety, depression, and sometimes suicidal thoughts. Next slide, please. So about the research we are doing. So basically we have three research questions addressed. So first is, what are the occupational health and safety challenges seafarers have confronted during the pandemic, and how they have navigated the COVID-19 pandemic constraints and risks. And for the key informants from the ship owners, from the companies, we have also inquired the support measures that are in place to help injured workers, also including their return to work process. So sometimes it's not just for seafarers working currently, but there are also many seafarers who like to return to their work. So the research methods we took, including legal doctrinal analysis, media coverage analysis, and qualitative interviews. So a total of 29 interviews were conducted with an average length of 101 minutes. So the interviewees are from Canada, China, India, including seafarers working at sea, waiting ashore to join vessels during the COVID, and ship managers, maritime welfare professionals, and a key informant from Maritime Authority. May I have next slide, please? Thank you. So the first finding, so also frequently reported by the seafarer, the infection risk on board the vessel. So through the interaction with the personnel ashore. And that was a major concern for seafarers, because on board the vessel, before signing on, all the seafarers going for the pre-screening questionnaire. And at the very beginning of the 2 weeks, they take social distancing on board. So the crew make a lot of efforts to make sure the vessel is COVID-free. But when the visitors coming on board, and in this case, basically pilots reported by a Canadian cook, Ian, so these pilots did not follow the COVID-19 protocol. So as described by the cook, Ian, he said that there were 2 pilots on board, and they asked me, where should I eat? I said, on the bridge. And they said no, and asked to eat in the mess room. I said, stay there. It's not you, but I have a suppressed immune system. I also have my career concerned if you insist on staying in the mess room. We need to let everyone coming on board know what needs to be done, follow our COVID-19 protocol. They said that they got screened. Well, I don't know who you had supper with last night. This is quite frustrating that the visitors do not follow the rules. We have difficulty to go ashore for months. So this is basically Canadian seafarers. They also facing restrictions of the shore leave. It's Transport Canada basically did not deny Canadian seafarers shore leave, but the issue is that the companies basically trying to make sure the vessel is COVID-free and restrict seafarers shore leave, or sometimes they would allow shore leave only in low-risk zone, but those low-risk zone, the vessel never call. So that makes seafarers have to sacrifice their shore leave opportunities. Well, these personnel, the interaction with onshore personnel issues is frequently reported by many Canadian seafarers and also international seafarers. And in one of the most recent outbreak of COVID-19 on a Chinese vessel, they doing loading in Indonesia, and all the stevedores refused to wear masks and refused to follow the COVID-19 protocol. And when the vessel returned to China, and then all the crew being infected. So that is a major issue, how to make sure that the COVID-19 protocol on board the vessel being followed by the stevedores, being followed by the pilots, was a major challenge for the seafarers today. May I have next slide, please? Okay, so the second issue is the crew exchange crisis for international seafarers. We were probably very familiar with. And during the multiple waves of the pandemics of the virus, then the crew exchange becoming very difficult. And sometimes if the pandemic getting controlled better, and then it's possible to do the crew exchange. This is a comment by the union representative Hank. So what he said is that there is no way to get you home. You just have to keep working. And some seafarers will spend their second Christmas away from their families. When I first started to address crew exchange problems, some seafarers had been on board for 12 months. And then I learned 14 months, and then later 17 months. Now in October, I found Burmese seafarers have been on board for 19 months. Canada exempted seafarers travel restriction and granted international seafarers essential worker status. Many seafarers can successfully use this exemption policy to conduct their exchange in Canada. It's a cost issue now for the company whether to send seafarers home. So for the crew exchanges, the worst issue normally would be the home state of seafarers restricts their return. And that makes the situation more complicated. And I have learned a different perspective for this crew exchange. So for example, like in Canada and Australia, the ITF inspectors would like to basically ask the captain or ship owner to provide a repatriation protocol, a serious repatriation protocol. But on the other hand, the flag states inspection, they thought that COVID-19 is a force majeure, and then ship owners could do nothing to repatriate seafarers. Then those port states control should lift the inspection of the maximum service period on board. So then I also interviewed a ship manager from one of the biggest ship management company. So what he said is that if the ship management company would like to arrange a repatriation for the seafarers, the most likely places is North America, including Canada and the United States and Australia, because that's where still inspectors, ITF inspectors and port states are caring about the maximum service on board. Europe, some countries would also possible, but in other developing countries, even though the seafarers are working on board for more than 17 months, 18 months, still that is not possible to repatriate them. And because of the North American and Australian port authorities still doing this inspection, it's possible for the ship management company to fight for or to apply a repatriation arrangement for their seafarers. May I have next slide, please? Yeah. So this is a international Chinese ship engineer, Feng's comment. So he said that he joined the vessel in October 2019, and his service period should have been 4 months. So he was on 4 months on, 1 month off contract before the COVID. And in June, many ports started to allow seafarers to sign off. I sent emails to companies asking to sign off, and the vessel was in Europe. And I learned that some seafarers signed off successfully, but my company refused to arrange it because the flight ticket would cost them $6,000 to $7,000 US, and the quarantine would cost about another $1,500. I was exhausted and could not continue working anymore. I tried to sign off in the United States, but the port policy required that the flight must take off before the departure of the ship. So in June and July, there was only one flight back to China a week. It was impossible to fulfill all the conditions. So including negative tests and 14 days on board, most ports would just refuse seafarer signing off requests. So for this case, this seafarer successfully being repatriated later. And in his company covered the quarantine cost. But in other cases, I have learned that seafarers have to pay the quarantine costs, $1,500 US themselves. Next slide, please, Jason. Okay, so short leave challenges. So short leave is always a complicated issue for both Canadian seafarers and international seafarers. So as a Canadian maritime welfare professional, Richard mentioned that in Canada, the government allowed controlled short leave, and the Sailors Club also adopted COVID-19 protocol after reopened in July. But very few seafarers take short leave nowadays. The captain may not allow short leaves. And we are now delivering groceries for seafarers and gangway. So maritime welfare professionals in Canada have made great contribution to help seafarers. And they have basically received the grocery list from the ship and purchase all those things needed in the supermarket and then deliver it to the gangway. So, and for the Canadian seafarers, this situation, the challenge is that the companies had policies in place that stated that short leave is banned, but they have come up with new policies that don't necessarily restricting every port, but they are only allowing short leave in port where their vessels don't go. So it's a ban on short leave. Basically, in fact, it's a ban. So we are fighting to get short leave because it's such an important component for mental health and well-being. So eventually, after the unions appeal, the arbitration appeal, everything. So before restricting short leave, the company need to consult the Canadian Union of Seafarers to decide those catch-22 will never happen for Canadian seafarers. I may have next slide, please. So some other challenges. So that is depending on the provincial public health measures. So for example, like in Newfoundland and Labrador, after signing off, seafarers need to take 14-day quarantine at home. If they have families at home, so for example, if their spouse need to work, their kids need to go to school, then they need to leave separately. So during the 2020, Newfoundland and Labrador seafarers have sacrificed a significant amount of family reunion time. But situation is getting better once the seafarers get vaccines. And then the Newfoundland and Labrador basically lift that restrictions. Both international and Canadian seafarers report difficulty to access medical care, including emergency medical care and picking up prescription in port. So in 2020, many shipping companies provide a delivery service to on board. So that also includes some prescription. But for some seafarers, they would like to keep their medical conditions at the privacy. So that's still very challenging for some seafarers because they still want to go for to take some primary medical care in port rather than just being confined on board. So inability to get vaccines in Canada. So some update here. So it's getting better, but for a long period to fighting for vaccines access is pretty challenging. Basically, we mentioned that in 2020 CMAC and in April CMAC 2021 still a problem, but things are getting better nowadays. And Jason and all the maritime welfare professionals nowadays also trying to provide international seafarers access to vaccines in Halifax, Vancouver, and Montreal. So some other challenges for Canadian seafarers is job loss. So in the tug sectors, so that is a huge issue there. So with the cruise travel bans lifted next year, things probably will be getting better. So to sum up, so COVID-19 created additional occupational health and safety challenges for seafarers, which makes working at sea further physically demanding. And during multiple waves caused by COVID-19 variants, these additional challenges may continue as a new normal for the global shipping industry. So that's all of our research sharing. So thank you very much. And if you have any questions, maybe we are now moving to the question time. Yeah.
Thank you so very much, Dr. Shan. One thing I forgot to note was that the reason why Dr. Shan is here, not only because she has a deep research interest in all of this, is because NAMMA and Dr. Shan at Memorial University have been in partnership throughout this year. We're doing gap analyses projects. She helped with a few students gather information for us on Canadian seafarers welfare. So thank you very much, Dr. Shan, for partnering with us on different things.
Thank you,
Oh,
Jason.
we have just a few short minutes, maybe 3, 4, 5 minutes for questions. Maybe we have a few questions coming up. One that was received from Helene Pearson from Philadelphia for Captain Arguin. Maybe also David Heindel might have something to say also from the labor point of view. What's your view on these various agencies charging administrative fees and other fees on top of getting the so-called free vaccine, but then they charge some administrative fee on top? What's the Coast Guard's view on that?
Thanks, Jason. So, we've talked about this in our, I guess it's bi-weekly meetings on providing access to seafarers, and we engaged the agents to get a better understanding of what's the reasonable going rate. And I would say that we didn't get a really a solid answer. It was kind of left up to the individuals. I would say that the idea or the concept of profiteering in this particular situation is something that the Coast Guard's interested. I don't know that we have a ton of authority to be able to do anything, from an enforcement perspective, but I'm also heavily engaged with CDC, and I've got a liaison officer down there. So if we are identifying specific instances where somebody is charging what would be considered an exorbitant fee, I'd like to get that information. I can push that over to our reps over at CDC for them to then engage back with the state, or at least have a conversation with that particular entity to understand why that fee was necessary. But the question points out that vaccines aren't commercially available, and that they've been basically distributed to the states for further distribution by the state health services. And so folks that are taking advantage of that, we're certainly interested in trying to figure out if there's something that can be done about that. I wish I had a better answer. I think it's pretty poor practice to really try and take advantage, especially in this situation.
We're right up against time, but David Heindel, if you'd like to give a point of view on this also from the labor point of view.
Yeah, well, obviously, there should be nobody taking advantage of the situation. And I know early on there were quite a few horror stories that we all heard with regard to the charging for vaccines or to administer the vaccines. However, I think it sort of has fallen, at least the complaints have fallen. None has come across our desk, either the ITF inspectors that I'm aware of, or me personally. I think initially there were opportunities that people seen that they were taking advantage of the opportunities. I think it might have been more of the agencies than it was anyone else. Certainly the vaccines are free. It was just the administration and getting seafarers from the vessel to whether it be a pharmacy or some service provider that was providing it that could run up some costs. But that's, that I think that's just a course of doing business. However, those exorbitant numbers that, like I quoted here, $6,000, we've heard those horror stories initially, but I don't think that's happening today. And if it is, I think we need to call them out on it and find out why that cost is so high. Certainly it shouldn't be, but I think if there are still problems out there, they should be elevated and provide, the information should be provided to us so we can look into it. But I don't know that that's actually going on today. And I hope somebody can correct me if I'm wrong, but I believe that that problem maybe has fallen by the wayside.
I do think that the combination of information sharing that the NAMMA website has provided multiple opportunities. In some ports, that may be the only option available, but I think there are other ports where they're able to effectively shop around. And if somebody's charging $6,000, there may be an alternative there that I think the work that Jason has pulled together, sort of that grassroots effort to be able to distribute that information, is helping drive that out.
Well, thank you, everyone. I'm sorry that we are out of time. I'd like to continue this. I will note, however, that we're going to have a whole sharing session tomorrow on the vaccination process. So everyone, more or less everyone on this call is involved in one way or another in a local vaccine effort. And so we want to share that best practice together in our call tomorrow. So we might actually hear some points. In the chat, Dr. Shan has shared I believe that's an article that where she has presented these findings in published form. And I thank you so much, Dr. Shan. Thank you, David, and SIU, ITF, all the different groups that you're involved with. It's great to work with you on, yeah, exactly, on all those different hats and the different levels. And Captain Arguin, thank you so much for all of your efforts, and all the best in your work